Pleasure to see everyone this afternoon. I'm glad that you could join us as we have our forum on campus response to COVID-19. It's with great honor that I introduce our president, Cheryl Green.
Good afternoon, everybody. I'm glad that you could join us as we examine the experience of COVID-19 and our mitigation efforts at Governor State University. Approximately 2 years ago to the date, COVID-19 hit the United States of America. Records show it was January 20th of 2020. The first case was reported. None of us could have imagined that 2 years later, we would still be trying to protect people and provide safety measures around this virus. But here we are. So I want to start out by saying that GSU has committed itself to providing the necessary equipment, supplies, and strategies to protect all of the members of the campus community, faculty, staff, students, and even visitors. And we are proud of what we have accomplished thus far. And let me say for the record, no single case of coronavirus is acceptable. However, we are doing many things to protect the campus. Some of the things we are in direct control of, and other measures you are in direct control of. Members of the campus community can self-monitor. Members of the campus community can quarantine when necessary. They can wear their masks indoors or out. They can engage in hand washing. They can sneeze away from people appropriately, use social distancing, and so on and so forth. The university has committed a number of dollars and resources, time and energy to other measures, such as booster shots being strongly encouraged for all members. We know that boosters and vaccinations together don't necessarily prevent the onset of the disease, but greatly diminish the experience of it. We also know that we have followed the governor's executive order, and we are enforcing the mandate that all members of campus be vaccinated. We went even further through the leadership of your colleagues in the College of Health and Human Services, and we stood up our own testing center. Initially, we contracted with Shield of Illinois, and they provided very efficient and viable services for anyone who wanted to be tested. But as the testing demand grew exponentially, we determined that in order to continue to comply with the governor's order and to promote the highest level of safety on campus, that we needed to do our own testing. And Dean Baltazar, who will speak with us later, and many members of her staff and other volunteers on the campus have made that happen. And I'm very proud of us being able to do that. We also are testing wastewater through a contract with a third-party vendor on a regular basis to detect evidence of coronavirus through other measures. We are still doing the bacterial sprays throughout the campus, where it especially refers to classroom activities. Of course, we have HEPA air filters in every classroom. And we have a response strategy that if there's any case that's reported on campus, there's enhanced cleaning and mitigation efforts that occur. Continuing further, we have a COVID dashboard that is updated on a regular basis. I believe it's weekly. And if you look at the dashboard, you will see that our positive rates are extremely low. And I know that it's in direct correlation to all of the multiple and multi-layered measures that we are undertaking and that you yourself are practicing. And we will need to continue to do that. I only want to provide updates about everything that we are doing to promote health and safety on campus. I also want to speak to our negotiated agreements with the unions. We have negotiated 5 MOUs with UPI, starting in spring of 20 to fall of 20 to spring of 21 to fall of 21 to now spring of 22. And as of a few days ago, an addendum to the latest MOU. And we are constantly engaged in conversations. We have always responded to a request to bargain. And we are very much invested into acquiring the items, the supplies, and instituting the procedures that will protect the campus. And so I just wanted to start with an overview of everything we're doing, because even though I spoke to the colleges days ago at the all college meetings, not everybody was present at the all college meetings. There were students not there, and some elements of the staff, members of the staff that were not there as well. And so I have every intention of communicating to as many people as possible all of the things that we are doing to protect the campus so that we can return to campus safely and that we can have face-to-face and group interactions with as much precaution and safety as possible. We are also conducting contact tracing, i.e. reporting through MedProctor for faculty, staff, and students. And we are basically doing everything that we can conceive of. The last thing I want to talk about is the mask issue. There's quite a bit of controversy on what mask, when to wear the mask, what the mask will do, what it won't do. It changes daily. And that's one of the things that makes managing the pandemic especially difficult, because the statistics, the recommendations, the science changes on a very frequent basis. But the university has purchased every possible version of the mask, the KN95s, the N95s, and of course the tried and true blue ones. So you get to choose which one you want to wear. Plus, I think I'm aware that the government has purchased large supplies, and now you can get free masks in a variety of places. So there are a ton of measures that the university is utilizing, as well as you yourself should be utilizing to protect not only each individual, but the other members of our campus community. So with that, I will stop and turn the floor back over to Sandra Merrick, who will introduce some of the other people who are present today to share with you about updates on coronavirus measures at Governor State University.
Thank you, Dr. Green. I'd like to take a moment to introduce our ERT chairs, Carolyn Johnson and Mushtaq Choudhury. You'll hear from them later, as well as Dr. Corey Bradford. He's the Vice President for Administration and Finance, and our Associate Vice President for Human Resources, Josh Allen. We will be answering questions, so if you have any questions, please feel free to add them into the Q&A section. We will have a section for answering questions before the session is over. Right now, I'd like to take an opportunity to introduce our interim provost, Colleen Sexton.
Good afternoon, everyone, and welcome to this forum. I am pleased that we have such a large attendance. I know that the health and safety and welfare of all the employees, students, and staff on our campus is so important. And We have spent a lot of time revisiting our operating plan, revisiting our communication plan, taking into account the changes that have happened because of the Omicron variant, and really trying to make sure that we have anticipated every possible way in which have we thought about this and thought about that to make sure that we maintain safety and health for everyone. So earlier today, you hopefully did read the email that came out from Dr. Green that talks about our new operating plan. And I shouldn't say new, it's just we made sure we updated it with current links, with current information that we're doing to address the health and safety. Faculty have always been interested in not only their own health and safety, the health and safety of their students, and concerned about, if students do end up testing positive and how do we address that. And we have posted on our dashboard, as Dr. Green spoke of, not just the positivity rates, but also the compliance rates with the requirements to be vaccinated. And we watch that almost on a daily basis. And we have implemented a few changes to that process because it is imperative upon all of the Jaguar Nation to be vaccinated and to follow the rules that we are following per the governor's executive order. So we have identified and we track either that you're testing on a weekly basis, and if you're not testing on a weekly basis and you're not submitting the documentation that you have been tested, you probably, as a student, have been getting emails from the registrar, as an employee, been getting emails from human resources. And we're making every effort to make sure our data are correct. So students who are in the audience, I do want to assure you, some of you have reached out to the provost office and said, I have my vaccination card, here it is. And we're trying to make sure that you submitted it via MedProctor, and or if you haven't, that we have it in there. So some of you might get a communication, but please read the fine print, because it does say, if you're receiving this in error, please reach out here and we'll make those corrections. So we're trying to be as accurate as possible to keep our community safe. But for those who elect not to follow policies and procedures, we are implementing a progressive discipline plan. So please read those letters over, because over time, if you are not following the requirements, there are disciplinary actions that are being taken. So read the letters. It's really important. Reach out to the registrar, to my office, if you have questions about the tracking of your compliance. So that's really important. I just wanted to point that out because we do highlight that in the introduction to our revised operating plan, some of those changes that we're kind of really tracking and following. So that's really important there. We do want to remind you that we do have testing. We make it easier for anybody here to come in and get tested. This is not for the person who has symptoms, but it is for you who think you might have been exposed. And before I go into more details, I'm going to ask Blaze, our technologist here on this call, we have a special message from Dean Kathy Balthazar, Dean of the College of Health and Human Services. She and a team of her faculty and chairs have been leading the Illinois Shield testing effort on our campus. And Kathy has a special message for you. So I'm going to ask that Blaze play that message, and then I'll talk a little bit more about where you can find the information.
Hello to all of you colleagues and friends at GSU. For those of you who don't know me, I'm Kathy Balthazar, Dean of the College of Health and Human Services. And I'm also the lead administrator for our GSU Shield COVID-19 test collection site. I'm here to give you an overview about COVID testing at GSU. And although I can't be available in person with you today, I would be happy to answer any questions you might have if you just email me. We serve between 150 and 200 GSU students and employees every week. The Shield Illinois COVID-19 saliva-based test is easy and results come back quickly. We've been finding usually within 24 hours. It is a PCR test, which is the gold standard for test accuracy. There are hours scheduled for Mondays in the Hall of Honors and Tuesdays through Fridays in the COVID-19 test collection site trailer located on University Drive. It's next to the building you might know better as Hantack House or the Grants office, right across the street from the big Paul Bunyan sculpture. We do prefer that you make an appointment, but walk-in testing is also available when space allows. We ask that you enter the test center at your scheduled appointment time and avoid lining up outside in the cold. Check out the hours and instructions for how to register on the GSU COVID-19 webpage.
I thank Dr. Balthazar for taking the time. Unfortunately, she cannot be with us today, so I thank her for recording that. But as you can see here in front of you, this is the webpage. When you log into our campus page, you will find our COVID-19 page, and then right off of the COVID-19 page is the page for testing. Please read all the directions. One of the things we're realizing is that there's an agency code, which is kind of coming in here a little bit blurry, but that's not the code for GSU. If you use that general agency code, you would need to then find GSU. So if you scroll down further, Blaze, you can see the hours that we have for spring, but then there is a specific agency code for GSU that if you're registering for the first time or when you enter it. So the 6B, 6D, 61WA, that's the code that will help you. Just one other thing, if you elect to do testing over at the Hantack House, one of the things people forget to do is they register, they got the code, they have everything ready, and then they get over there, and I'll admit I was even guilty of it. I have it up, I have it on my phone, and then they're like, did you sign off on the, the approval form? And we tend to forget that piece. So you need to actually follow through, have your little form docu-signed, and then show the people in the trailer your form that you approved it, and then they'll give you the materials to get tested. So that's one little step. I noticed the day I went over there, right when we came back to campus, a lot of people were in the same boat. So read over the instructions here, and it's designed for you. You can go in and test every week if you like, just for your own health sake to, if you feel like you've been around someone, but please don't go there if you are experiencing full-blown symptoms. You would be better served for your own health and for the health of those who are going to the trailer and those who are administering the tests to, check out some of the local pharmacies that do the testing with the nasal swabs where you can do it from your car. So Sandra, I'll let you take that over. Maybe we have Mushtaq and Carolyn talk a little bit about masking, or do you want us to start with some questions?
Thank you, Dr. Sexton. That is actually one of our questions. So Carolyn or Mushtaq, can you please tell the campus how they can get a mask?
So the masks are ready. All the classrooms have disposable masks available in all the classrooms across campus. Additionally, if there are offices who need to request any type of PPE, our folks in procurement have created a DocuSign document on the portal. If you go in there and you fill the form out and you submitted it electronically, it'll come to Carol and myself. Typically, we approve it right away. Unless we have some questions, we may do a follow-up if necessary. And on that form, there's all the options of types of masks we have. As Dr. Green indicated earlier, N95 and KN95 masks are available. Right now, the form is being updated as we speak. Our procurement is updating it to add the N95 and KN95 masks to that. However, if you need a mask sooner, you can always email Carol and myself at ert@govst.edu. that email goes straight to Carol and myself, and we will contact that office and work with them one-on-one to get them exactly the type of mask they need. And the key, obviously, is wearing it properly. So Carol did put some education on our COVID website, instructions on how to wear the mask properly, and I'll let her talk a little bit more about it. But folks, the key is making sure it's a good fitted mask, worn properly, not a mask that doesn't cover your nose, it doesn't cover your mouth. The key is to make sure both your nose and mouth are completely covered. Carolyn?
Sure. To touch base on the fit of your mask, it's super important that regardless of whatever mask that you choose to wear, that it provides a good overall fit onto your face. So when you put on a mask, whether it be a KN95, N95, or a cloth mask or surgical mask, when you are talking and breathing, if you are feeling air escape around your nose or below your chin, that may not be the best mask for you because it doesn't provide the correct fit and seal for your face. Luckily, there are so many different variations of these masks, so many different sizes. The one thing to do if you are choosing to wear an N95 mask is ensure that it is a NIOSH approved N95 mask. Masks come in all different shapes and sizes, so there is one shape and size that will fit you best. There is some language on the website, on the COVID-19 website, if you need visuals to see how to put on the mask, how to take off the mask, and kind of goes over the same processes that Mushak and I just discussed.
Thank you, Carolyn. All right, I have a question that was submitted in advance. And here it is. Due to HIPAA, we do not know who is vaccinated or is not vaccinated. So how is GSU going to keep track and make sure that staff is getting tested weekly? Josh, can you take that, please?
Thank you, Sandra. So right now, our team in Human Resources is tracking all of our individuals who are vaccinated and or testing through MedProctor when they upload their results. Like Dr. Sexton mentioned earlier, our Human Resource Department will be sending out emails to those that either are not vaccinated and not testing and not meeting our requirement highlighted in our interim policy. To follow up on Dr. Sexton's message, if you do receive that email in error, please reach out to Human Resources so we can correct that error for you. As we work with computer systems and test weekly, we are getting some erroneous data that gets pushed out, and we can fix that for you on the spot, and our team is ready to assist in any way necessary.
Thank you, Josh. Dr. Sexton, is the testing center only for GSU employees and students?
Currently, yes, that is a service we're providing for our own GSU campus community for employees. There may be a time where we're exploring right now if we have the capacity to expand and open it up to the community. But currently it is still GSU employees and students and staff, so everybody here.
So I would like to add that everyone knows that last spring we did 7 pop-up vaccination clinics for not only GSU, but the campus, but the surrounding community. And we vaccinated over 1,900 individuals. And I'm very proud that GSU not only moved to protect its own community members, but also our neighbors and our critical stakeholders in the immediate geographic environment. We did that at a time that the vaccine was very scarce. The vaccine is not scarce for most, if not all, communities. You can go to Mariano's, Walmart, Sam's Club. I've been saying publicly, you can go everywhere but the gas station and get a vaccine shot. So it is readily available. All you have to do is put in your search bar of your phone or your computer, vaccination near me, and it will pop up by zip code within a 1, 2, 3, 5, 10-mile radius, all of the sites that are close to you and what kind of tests you want and when you want to go. So.
Thank you, Dr. Green. So we have some questions about being in compliance with vaccinations. So here's the question. If someone is fully vaxxed and boosted, do they also need to test weekly And where can they update their data for their booster and or their tests?
Okay, so I'll take that one, Sandra. Thank you.
Thank you.
So if you are vaccinated and boosted or vaccinated according to our interim policy, you do not have to test weekly. Now, to upload your test, you'll do that through MedProctor, or you can drop a copy off with the Office of Human Resources here. We'll take care of that for you for employees. Colleen, did you want to talk for students?
And it's the same process that all students use MedProctor. There's the difference. So I know some students have been receiving information and, saying that they're not compliant, and they've been sending their cards to me. I've been reaching out to the registrar's office, and I know that the registrar's Tim Carroll is reaching out to those students and explaining where they need to submit the card. So it's via MedProctor. It's the same place where you are already submitting when you have to submit proof of immunizations. That's the same portal we're using to submit your proof of your COVID vaccinations.
I would just like to add that through an abundance of caution, we did ask all people who were returning, employees, faculty, who were returning to campus, to do voluntary testing, whether you were vaccinated or not, because we're all aware of breakthrough cases. And so again, that was just an additional layer of surveillance that we were asking people to go through. I myself went through it. And so it just gave an additional measure of security around exposure when vaccinated and boosted, which I am both, are still testing. One or two campuses are mandating surveillance testing, irregardless of your vaccination status. But we have our hands full testing the people who are not fully in compliance with the vaccine mandate.
Thank you, Dr. Green. There's another question about the booster shot. Will it be required in the future? And would you like for employees or students to resubmit their vaccination cards if they've already been boosted? So let me break it down. Are we going to require the booster shot in the future?
We are constantly reviewing guidelines, directives, policies, and statistical outcomes on the incidence of the virus. At this time, we're not mandating the booster shot from the university standpoint, but it is strongly encouraged that you do that to protect yourself, because you're not always at the university. You're at home, you're among your family, you're in your communities. And so to protect them, also get the booster shot. Don't wait on the university to mandate it. Get it anyway. And it's just another layer of protection. A couple of campuses are mandating. We have not gotten there yet, but we constantly look at the data. We constantly review and discuss where we need to land at GSU. And GSU has some of the lowest incidence rates among all the publics. So what we're doing is working. It is working because we are constantly monitoring and revising what needs to happen to keep our campus safe.
Thank you. I have a student question. What is the university doing to ensure social distancing in classrooms and in public places? Carolyn or Mushtaq, can you take that for me?
Sure, I can take this question, Sandra. Currently, right now, Illinois is in phase 5 of the Restore Illinois plan. So what that means is there are no capacity limits and no social distancing guidelines. However, as a proactive approach, we have taken a look at all of our classrooms and have decided that we will not be doing 100% occupancy for our classrooms. So any class that you have in person on campus will not be set for 100% to allow social distancing where feasible. We've also set up our cafeteria in a way to allow, again, the option for social distancing and to make it feasible for you if you choose to social distance. So we have taken a look at things that we can do to improve the safety for our campus community.
Thank you. Thank you so much. All right, we have a question about the water, the wastewater. They'd like to know what is the wastewater being tested for, and can you explain what that means?
Sure, I can take that one as well. This is our second time doing wastewater sampling, and what that means is wastewater is being tested throughout campus for COVID-19, for traces of COVID-19. We did similar testing in the fall, right after move-in. And that was part of our Healthy Building Institute program that you may see placards up on the entryway doors outlining that we are a healthy building. We will be doing that again shortly. I'm planning hopefully next week. And what we do is we test wastewater through several locations of the campus, including the Family Development Center and Prairie Place. And these tests will not only be able to detect COVID-19, but I'm having discussions with our lab to possibly help detect variants as well, to see if we do test positive for COVID-19 on campus, what variant it may be. So this is an initiative that we plan to continue and do, again, to ensure that the health and safety of our campus is utmost priority.
Thank you, Carolyn. Josh, I have an HR question for you. Are we still working remotely 2 days a week, or is that over?
Thank you, Sandra. Yes, our remote work policy is still in effect. So if you do not have a remote work agreement on file with your supervisor and want to take advantage of that, and your duties can be done remotely and efficiently and effectively, please work that with your supervisor, and that form will be you'll want to have on file with Human Resources.
Thank you. I have a question about positivity rates for our campus. Can you share the statistics or tell our campus community where they can find campus community specific data on positivity rates? Carolyn or Mushtaq?
Yeah, I can take this one. So the community goes to our landing page, govsd.edu/COVID-19. If you go to that landing page, COVID-19 landing page, and scroll down to the bottom of the page, there's some hyperlinks there. One of them is the ability to click on it. Once you click on it, it'll open up another window and let you see the dashboard. We kept our dashboard. When we started collecting information for our dashboard back in August of 20, we kept it up there so that you can see the historical data as well. It's weekly updated. It's updated by a collaboration between Dean of the Student's Office and HR. When we run the numbers every Monday morning, and once we have studied the numbers, we go ahead and post it on the website. So we ran the numbers yesterday. Folks in HR and myself and Carolyn are looking at the data, and then once you've cleared it, it will be posted up for last week's numbers as well.
Thank you, Mushtaq. Dr. Green, I have a question for you from a student. What is the university's response plan for commencement in regards to COVID?
Thank you for that question. I had the same question a few days ago. So Karen Caesar is my point person on all things around commencement activities. And she is making a presentation to Cabinet about the collective agreement, the contracts, what's been reserved, the costs, so on and so forth. And she will be making their presentation next week. There is a website I found out called govst.edu/commencement, I believe it is. And you can go to that page and get updated on all things commencement. Now, I did speak with her today, and I found out that the information that is posted as of right this minute does not include the May 22 graduation. what I can tell you is the cap and gown ordering is the third week of February. Salute to Grads Fair is targeted for March 8th. Cap and gown pickup is scheduled for April 26th. And all of the commencement related courting and other kinds of activities are going to be spread out over May. And so they are just now getting the contract signed for all of these different activities. It is our intention to have a live ceremony at the Tinley Park Convention Hall. But we will be closely monitoring, as we have been for some time, the data, because it changes, you know. One month it's down to 2%, another month it's spiked to 15%, and you know, so we are constantly trying to manage. But at this time, we have every intention of having an in-person live ceremony at the Tinley Park Convention Center. And the website on commencement will be updated by the end of the month.
Perfect. Thank you so much. I have a question about masks. Are we specifying that face masks, K95s, N95s are the only masks to be worn, and staff or students should not be wearing bandanas? I will defer this one to either of our ERT chairs.
Okay, I'll take this question. So the university is requiring face coverings. However, we are not requiring KN95 or N95 masks. With that being said, on our COVID-19 website, we have a list of masks. This links to the CDC as well, that describes all the masks that associate and can be used as a face covering. But again, we are not requiring KN95 or N95 masks. However, you are more than free to voluntarily wear one on campus.
Perfect, thank you. Carolyn, can you tell everyone the email contact for obtaining masks if they need one here on campus?
Sure. Until the form is updated, you can reach Mushtaq and I at ert@govst.edu.
Perfect, thank you so much. All right, so they would like to know what percentage of the GSU population is vaccinated. Josh,
We have new.
I'm sorry.
how about we do Colleen on one side for the students and then Josh for employees?
So just this morning, we received some data from our usual update team, and how we define for our students is either they're testing weekly or they're totally 100% remote, so they're not, and they wouldn't be allowed if they're not compliant. That's 83.6%. The percentage of our continuing students who are compliant or remote, so that would be students who were in classes in the fall that are now in classes in the spring, or they're in remote classes, is 90.39%. So we do have some students that we're working with that are not compliant between continuing and new, or maybe even stopped out students, about 600. Those are the students that if they're not submitting proof of vaccination this week, by the end of this week, we'll be getting letters from the registrar identifying how they could get compliant, what would be the steps they need to take, and or what will be the disciplinary measures for them not being compliant. And each week it's progressive. There'll be a fine by the second week, and there'll be another additional fine as well as count holds. So we're doing our best to assure that people are compliant, and that you could be reasonably assured that if they're in a classroom and they're masked, that they are abiding by our campus processes and policies.
Thank you, Colleen.
Okay, and from the employee side, we have 84% of our employees vaccinated, with 90% compliant. Much like Colleen said, the 10% that are not in compliant will be getting letters from Human Resources this week. And if you find that you have received a letter when you had submitted proof of vaccination or testing, please ensure that you reply to that email and provide your proof to Human Resources.
Thank you, Josh. Since I have you here, can you tell me if someone gets their weekly testing through Shield, do they still need to upload the results through MedProctor?
If your Shield testing was done on campus, you do not. However, if your Shield testing was done off campus at another university, you will have to upload that to MedProctor.
And what happens if an employee is not in compliance? Will they be disciplined?
So we do have an interim policy for our COVID-19. And yes, we are sending out those letters. And if you have been lucky enough to receive one of our letters, you notice on there that it references our policy and it says you've not been in compliance for either 7 or 14 days. In reference to our policy, if you exceed that 14-day time frame, you may be banned from campus, which could affect your pay from an employee perspective. So I highly recommend if you receive one of those letters, do not sit on it, please. Contact Human Resources if it's an error, or become in compliance by either A, becoming fully vaccinated, or B, continue to do your weekly testing.
One last question on the testing. Are employees able to utilize home COVID tests? And if so, how do they notify GSU of their results?
Mushtaq, do you want to take that one?
Currently, we are not accepting home COVID tests. However, given the abundance and availability, more and more tests that are being shipped out by the federal government, and since the reliability of the tests has improved as well, a few of us are already meeting to discuss that and see how we can basically adjust our policy to accept home tests as well. Because obviously we know the federal government is shipping out home tests, and what we understand, especially talking to our folks in Advocate, Aurora Health, our partner on campus, the home test is more and more reliable. 6 months ago, they weren't as reliable, but now the science has changed and it's a lot more reliable.
Thank you, Mushtaq. So my next question is, do we have any commentary on classroom space or room reservation updates? And are there any updates on allowing external room space rentals? Let's see, Dr. Bradford or Dr. Green?
I would defer to Dr. Bradford since facilities reports to him. I know that we have hosted some events on campus over the last few months, and we would like to continue to do so. But again, we are constantly looking at the latest data to inform us and guide us on not only whether we can have an event, but how large the event is, where the event will be located, and what protective measures our guests will need to use. An example would be the CPA. They are using the Chicago Theater guidelines, which are different than the university guidelines. And so this is a myriad and complex issue that we are constantly analyzing. We want to host large gatherings. We want to host events, and we will do them if it's feasible, if it's safe.
Yeah, and I would just add that this is something that the COVID colleague committee will be discussing in upcoming meetings, the pros and cons of allowing outside groups to come on campus and making sure that we have the proper safety protocols in place for the different groups.
Thank you. I have another question, probably for ERT chairs. When a student tests positive in our class, what is the expectation of when the instructor would find out about this exposure and who would reach out?
I will actually defer that to Dr. Sexton, because what happens is once the student reports it to ERT, we immediately notify the provost office, and they have a process in place that's on our website available for anybody to download as well. But Dr. Sexton, I'll let you, since it's your process, I'll let you walk through it.
Thank you, Mushtaq. So we have had this process in place since we had to turn on a dime and go to COVID mode back in March of 2020. And we've been refining it as we go along. So Fortunately, we're to the point where sometimes students let their faculty know before they submit their report to Med Proctor. So kind of two things I want to clarify. When you go to the page, the dashboard where you see the count, that is the count that is from our Med Proctor account, so that we know exactly who's getting tested or who has submitted that they had a negative test from an outside source. But that is not the last stop for a student. So a student shouldn't think, well, I put it in Med Proctor, people will know. The student needs to go to the Dean of Students office, where we have a Maxian form that they will fill out. It's a self-reporting form. As soon as they get that, Dean of Students office staff get that report, they reach out to me, where they have already informed the student to remind them per our communication process that there is a request for absence form. So just because they reported that they have COVID and they're feeling poorly and they won't be able to be attending class, we remind them to submit the absence form, because if they need accommodations because they are going to be missing multiple classes, that's the form that triggers the reaching out to faculty from a compliance standpoint. That being said, as soon as I get the report that a student has self-disclosed that they tested positive, I get their class schedule. I email the chair of the divisions, maybe multiple chairs, and the faculty members that are on the student schedule. And I work with them depending on when the student said they were last on campus, because some cases they were on on campus well before their symptoms. So in that case, we just say you have a student, they should be reaching out to you. They haven't been on campus in 5 days. You can continue to meet face-to-face. But then we have other times where the student literally came to class, felt poorly, got tested, found out that day or the next day they were COVID positive. We immediately, as soon as we get that notification, reach out to the faculty and the chairs again. And there's been times when it's like, go remote, just go remote. Here's the directions to tell your students what they should do to test themselves, to watch their symptoms, to go get tested. We tell the faculty the same thing. And typically the chairs and the faculty and myself, if needed, will meet, or they'll inform me of what processes they put in place. I do want to add that many of you probably have listened to the CDC and their recommended changes from the 14-day isolation to the 5-day, with the first day you notice the symptoms being day 0, and then 5 days thereafter. That is like the CDC recommendation that we're recommending to employees, but we have recommended to students, and you see that in the operating plan, that we're recommending 10 days. So day 1 is, the first day. So then you have another 9 days. And we've been questioned on that. We have an answer on our FAQ page about it. And it's primarily because we are a commuter campus. We have a small number of students in the residence hall in Prairie Place, but the majority of our students are coming from all over. So it's not like a primarily commuter campus, such as some of our other state institutions where most students live in the small rural college town and they're all in the residence halls. We're very different in that our students are commuting from a variety of places, north, south, east, west of our facility. And to better assure the health and safety, we're recommending 10 days isolation, even if you've been vaccinated before you come back. But by filling out that form about the absence form, and it's an absence form that even if you got sick with the flu, we recommend students complete. That triggers then the faculty member being officially notified from Student Affairs that please work with that student and make accommodations for any kind of missed work.
Thank you, Colleen. So about masks, we have several questions about how employees should handle other employees, staff members, students or visitors on campus who do not have a mask on? What should they say to them? Especially if they perhaps offer a mask and they refuse to put one on. I know everyone could answer this question. Dr. Green, would you like to chime in first, or perhaps ERT?
I would like for ERT to have.
All right, perfect, thank you.
I personally will not allow somebody to come in my office and sit down and talk with me or meet with me without a mask. When you're in your private office, you don't have to wear one. But as people come in, or you go out, you should have one on. And if someone came to my office and refused to, I would cancel or reschedule that meeting. Yes, I would. And I would not ask anybody permission to do that, because my health and safety in my office and in my suite is very important to me, as well as to the other members of that community. So that would be my answer, but that's not the faculty with a student or whatever answer. So ERT, Colleen, feel free.
Thank you, Dr. Green.
I can start, and then Colleen, feel free to jump in. I think we are at a point where it's appropriate for somebody to remind others on campus, hey, masks are still required on campus. Sometimes people do honestly make a mistake. I mean, there have been times where I've almost walked out of my office and gone to the bathroom. Mm-hmm. I'm in the bathroom, realize, oh my God, I forgot my mask. What am I thinking? I mean, people can genuinely make a mistake. I think we're at a point where we can remind each other, just for our own wellness, that, hey, a mask is required. I mean, I was in the cafeteria yesterday, and two students walked in, and one of them didn't have a mask on. I just looked at the student and said, "Where's your mask?" And he's like, "Oh, I totally forgot it." And they just, there was some mask on the table over there by the cashiers, so they gave him one and he put it on. But sometimes I think people just forget it. But I think we're at a point that we can remind someone. Also, keep in mind, if you have a disability, there are accommodations where you can't wear a mask. So keep that in mind as well. Don't just assume somebody's not complying, but keep in mind, we do get students every so often who have gone through the process and have an accommodation and cannot wear a mask. So if there is a student like that, we work with departments individually to see how we can help the student and still get them services they need, and with making an exception to the mask. So just keep that in mind as well. Sometimes there are people who generally just can't wear one. But I think we're at a point where I would hope if I was walking around with a mask, somebody would remind me, say, "Where's your mask?" Because honestly, sometimes I think we make true mistakes and just forget to put it on. Overall, from my perspective, from ERT perspective, I think the campus are doing a good job in complying with the mask request. I mean, there's signs everywhere on campus. Very rarely do I come across, and mostly it's a student, and sometimes students just need a reminder. They're young adults; they just need reminders.
One other question.
I'm sorry, I can add that I know that we have had this conversation about vendors who contract with the university, and we have modified, Corey, Dr. Bradford, we have modified our contracts to include this as a requirement. If you have a contract with the university and you're receiving monies and providing a service, then we have to enforce the governor's executive order. Unless it's an extremely brief and episodic visit, if you are here to do a prolonged service of any significance, you must wear a mask. The other thing I wanted to say that I thought of when Mushtaq was talking is, with regard to student interactions who come to your office and you're a faculty member, there's absolutely no reason why you can't request and insist that that meeting occur by Zoom.
You read my mind on several things, Dr. Green. Thank you so much, especially about the vendor and contractors, because that was one of our questions. I have a question for Josh. Josh, if a staff member is recovering from COVID-19 but has received a physician's confirmation of long-term effects such as fatigue and chest pain, should they resume coming to campus?
So that's a great question. And I think with talking to your physician specifically, we do require that doctors know or negative test to come back to work. Now, if you do have long-term effects associated with COVID-19, talk with your physician, and if accommodation is needed to help you do your job, that's where Human Resources is here to help you out.
Perfect. One more question for you. Do you recommend if someone has cold-like symptoms and has tested negative prior to coming to campus that they continue to come to campus?
So part of our operating policy for the spring semester outlines things employees should do daily before they come to work. And one of those things is to monitor for symptoms. And we have, the CDC's outlined a list of those symptoms. What I would recommend is if you can work remotely and you're able to work remotely per our guidance, that you take that opportunity because you might have tested too early, who knows. But if it's just like before COVID-19, if we're sick and we don't want to spread colds and flus, do the responsible thing and stay home.
Thank you so much. We are pretty much at the close of our hour. I still have quite a few questions left. Dr. Green, I can continue going, or we can close this out and we can circulate answers to all the questions that I have remaining to the campus at large.
Can we do a little of both?
Sure, we certainly
it's 3 o'clock. Can we go another 5 minutes? Will that disrupt? I know people may have 3 o'clock meetings, but I don't know how many questions we can get to in another 5 minutes.
I can certainly do a couple more and then shoot out the remaining answers to the questions that went unanswered. This question is for either Colleen or Josh. When you say compliant, are you including regular testing, or are you specifying 80 to 90% are vaccinated?
When go ahead, Josh.
Yeah, I can speak from the employee side. And when I say 84% vaccinated, that is who have met our vaccination, received either the 1 shot of Johnson & Johnson or the 2 shots of Moderna or Pfizer. That is what we're calling vaccinated. When we talk compliance numbers from an HR perspective, we're talking if you are not vaccinated, you are testing weekly and meeting the intent of our policy. So our testing plus our vaccination goes into that 90% number I discussed.
And for students, the numbers are being reported as compliant because many have elected to take all of their courses online. So that means we're talking compliant, not vaccinated.
Thank you. Josh, I have a question for you. Are there any provisions that allow employees who live with others who are high risk and unable to be vaccinated, such as young children, to work remotely, or teach remotely, even if the courses have not been officially approved for online delivery, in order to avoid infecting their loved ones? So I think that this is partly Colleen, partly Josh.
Yep. So I will take the employee side of it, or the staff side of it. What I would say is every case is unique. We've seen that in COVID-19. Accommodations can be granted for certain situations. I would advise for that specific or your specific situation, reach out to Human Resources. We can look at your situation more in-depthly and provide you an answer on that.
And then from the teaching side, I will say that students, and I'm well aware of this, specifically pick their courses for spring based on what was the posted delivery mode during registration. And so we have a large cadre of students who want to be face-to-face. And if they have to move to remote, need accommodations and would have to reach out to our ADA office to get those. And so what I would recommend, if you know that you have to do remote, that you work with your chairs and deans to be assigned to classes that are already posted as being delivered online to whatever extent possible. Another accommodation I have seen happen is where the faculty remained remote. The students did come to campus. The chair met with the students in a hybrid classroom so that the students were still there, the chair was working with the students, and the faculty was delivering the content because of that unusual last minute need. But we do really want to make sure that we're meeting the needs of our learners, and our learners are picking specifically, and when working with their academic advisors, their course schedules based on the delivery mode in which they're most comfortable. And I know that many who are, being, especially like just last week where some faculty did elect to go remote, that it did cause some angst for some of our students, either because of lack of communication and/or because even though they knew it went remote, they wanted that face-to-face. So we have this delicate balancing act between meeting the health and safety of the faculty or anyone who is interacting with our students and the needs of the students and how they're selecting their courses.
Thank you, Colleen. Mushtaq or Carolyn, I think this is a question for you. Will GSU provide home tests for students?
My answer would be the federal government has free home tests. And you can get 4. All you have to do is log on to the website, and it takes about 30 seconds to put your name, your address, and it's optional to put your email in for updates, and they will send you 4 free home tests.
Thank you, Dr. Green.
So let me just say one more thing. As GSU continues to endeavor to make the campus safe, we cannot become the federal government. We cannot provide any and every service in the same abundance and quality that the federal government does. So if there are resources that exist outside of the university that are valid and effective and approved, then we strongly encourage you, to the degree that it's appropriate, use those resources. For example, the mask. We've ordered thousands, but we will run out. And we may have some supply chain issues getting some more. Federal government has more power than we do to get masks. So feel free to take advantage of their available supply and don't go without one because you couldn't get one from GSU.
Thank you so much. We are at the end of our session. Dr. Green, would you like to make some closing remarks?
I have felt that this has been a very productive conversation. The variety of questions, concerns, and information shared, I hope, has been very beneficial. These conversations will continue. The sharing of communication will continue because we are navigating this pandemic episode in America and at GSU on a daily basis. And we will be victorious in our efforts to protect you and ourselves with your cooperation, with your understanding, with your patience, and with your vigilance along with ours.
Thank you, Dr. Green. Thank you, everyone, for joining us this afternoon.
Thank
Thank
you.
you.
Thank you, everybody.